A big moment this afternoon. President-elect Joe Biden has been vaccinated for COVID-19. He follows Vice President Mike Pence, who was vaccinated live last week, along with several members of Congress, including House Speaker Nancy Pelosi and Senate Majority Leader Mitch McConnell. For more on this, I want to bring in Chief White House Correspondent John Karl. John, let's talk about how important it is for leaders right now, like Joe Biden or Mike Pence, to get vaccinated in such a public way. I mean, yes, it's a good PR move, right? But there's also a lot of confidence that needs to be instilled in the people right now, people that are still very nervous about it.
There's a lot of reluctance in the country, Kira. There's a big segment of the population that is uneasy with the vaccine, and in some polls suggesting it could be as much as 30%. So to see the leadership of the country step forward and say that we have so much confidence in the efficacy and safety of this vaccine that we'll be among the very first to take it is very important symbolically. And of course, in the case of Joe Biden, it's also incredibly important in terms of protecting his health.
So why do you think there has been concern and pushback about getting the vaccine? Where do you think that's coming from?
Well, I think there are two areas that it's coming from. One is we've seen a movement in this country for several years, as you know, Kira, that a segment of the population that just simply is anti-vaxxer. They don't believe vaccines really work. They believe vaccines, despite all of the evidence, all kinds of vaccines, not just this vaccine, have negative side effects. That's been disproven time and time again, but there is simply a segment of the population that is skeptical. Now, there's also the fact of this vaccine being something that has happened so quickly. I mean, we've never seen a vaccine developed on anything like this time frame, and I think there is some residual concern in some quarters about how quickly it was done, particularly when you've seen so much that's been said about this pandemic from officials in government, particularly from the White House, particularly from the president himself being called into doubt, called into question. They've said time and time again things that just are not true. So now the country is being called upon to trust the word coming out of the government. Now, that said, the real, the kind of good housekeeping seal of approval on this is Dr. Anthony Fauci and the other medical experts in the government and outside of the government. And universally, they are saying this vaccine is not only a good thing, but it's an essential thing to getting beyond the pandemic.
And even Dr. Fauci, John, as you know, has come forward and said he thinks President Trump should get it as well. Let's talk a minute about the president. We're not seeing much of him. He's definitely not talking about this. He continues to talk about losing the election, that it was rigged. Now, he did have COVID, and if you talk from a scientific perspective, you'll hear this from some medical experts that, look, he had the monoclonal cocktail. It's supposed to be within 90 days. He doesn't necessarily need to get the vaccine right now. And then the White House is kind of giving this message that, well, when the medical team decides he'll have the vaccine, he will. What's your take? Why do you think Trump isn't just coming forward and saying, okay, let's do it. I'm rolling up my sleeves. I'm going to have the vaccine too. Let's go.
Well, look, there may be, as you said, there may be good medical reasons for him not to get the vaccine yet, for a period of time to pass from having COVID, having the treatment that he got before he gets the vaccine. But you're right, he has said virtually nothing about it. A little bit of, bragging mostly on Twitter about the rapidity with which the vaccine was developed and taking credit for this. Actually, there was a moment at a White House press briefing just a couple of weeks ago where the press secretary referred to the vaccine as the Trump vaccine. But what we haven't seen is exactly what you referred to, is Donald Trump coming out and saying, damn right I'm going to take this vaccine. I'm going to take it as soon as the medical team tells me I should take it. He has not done that. He has not taken that step. But as you point out, he has had virtually nothing to say about anything. Actually, I'm going to leave it at that. He's had virtually nothing to say about anything for the past week, as we have seen the incredible news on the vaccine, the incredible disturbing news about the virus itself and the route that this pandemic has taken. He has been out of sight, virtually no public appearances since he was at a football game last weekend, the Army-Navy game. He has not been out. He has not had public appearances at the White House. He did about a 4.5-minute appearance on Rudy Giuliani's radio show, and again talked about the election conspiracies and whatnot, but almost nothing about the pandemic or about the vaccine.
John, stay with us. We want to bring in ABC News medical contributor Dr. Darren Sutton now. Bring him into the conversation. We had a little bit of a technical hiccup, so it's good to have you with us now, Doctor. What you want to weigh in on that with regard to President Trump and not getting the vaccine yet? Well, we've seen other key leaders in our country getting that vaccine in a time where we want to instill confidence and we want people to get inoculated. We want to get rid of this pandemic. How important do you think it is from a PR standpoint that the president get the vaccine also?
I think it's incredibly important. The current recommendations for anyone who has had a prior, whether or not you've had COVID-19 before or not, the recommendation is to get the vaccine. And so the president coming out and standing in his support and stating that he would get it would be really helpful. But there's also a lot that we don't know. The president had a significant hospital stay, and as you referenced, he required synthetic antibodies as well as antiviral treatments. So there's a lot in this discussion that we don't know about that is probably personal between him and his physician.
So, Dr. Sutton, what's the biggest thing that you want people to know about getting through these next few months?
Well, as you know, I am in California, specifically Los Angeles, and we are right up against a significant surge as approximately 88% of ICUs all ICUs are approximately 88% capacity right now across the LA County. So right now, it's honestly, you need to pay attention. I would advise to every single resident wearing a mask and keeping a safe social distance. And even if you don't live in California, I would advise the same to help decrease the spread of this virus.
Well, I'm with you on that. I'm from California, and I talk to my mom every day, so I'm going to tell her exactly what you've advised, Dr. Sutton. Thanks so much. And, John, I have to ask you, while I have you, Congress is expected to vote to pass this $900 billion stimulus deal today. Democrats say this is just a down payment and more help is needed. But if Mitch McConnell still controls the Senate next month, is another deal likely to happen? What's the reality check?
The reality check is really in almost either circumstance, it's going to be hard to get more done. Of course, a lot's going to depend on what is happening with the vaccine. Has this helped put the pandemic or start to put the pandemic behind us and allow more of the country to be reopened? Or are we seeing a continued downward spiral? If it does continue to look bad, there'll be enormous pressure on Congress to act again. But McConnell made it very clear in negotiating this one that this was as much as he thought Republicans were willing, as far as Republicans were willing to go. And it's certainly a significant step. I mean, look, Democrats were pushing for something, 2.5 times larger than this, Kira. But we shouldn't lose sight of the fact that this is a $900+ billion funding bill. It's the second largest bill of its kind, funding bill of any kind, that we've seen Congress pass, and the first largest was what was done in the spring to deal with the economic impact of the pandemic. So this is a significant step, but there will be a lot of pressure on Congress to do more.
All right, John Karl and Dr. Darren Sutton, thank you both so much.
Thank you, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.